Welcome to our channel. Today we are going to cover some important MCQs on hyperlipidemia with answers and explanations to boost your understanding for exams and other clinical practice. Let's get started. First question: which of the following is the primary target of therapy in hyperlipidemia according to most guidelines? Options are HDL cholesterol, triglycerides, LDL cholesterol, and total cholesterol. So the answer will be LDL cholesterol, just because हम उसे bad cholesterol भी कहते हैं. It plays a biggest role in atherosclerosis. It lowers the risk, it reduces the risk of heart attacks and strokes. HDL and triglycerides are also important, but they are the secondary targets. Second questions: statin exert their lipid lowering effects by inhibiting the intestinal cholesterol absorption, inhibiting HMG-CoA reductase, stimulating lipoprotein lipase, inhibiting the cholesterol ester transfer protein. So the answer will be inhibiting the HMG-CoA reductase, because the statins they inhibit the enzyme which is the rate limiting step in cholesterol synthesis in the liver. This lowers the cholesterol production and increases the LDL receptor expression, helping to clear the LDL from the blood. Third question: which class of drug is primarily used to lower the elevated triglyceride levels? Options are statins, bile acid sequestrants, fibrates, PCSK9 inhibitors. So the answer is fibrates, because example like fenofibrate and gemfibrozil, they are the drug of choice for higher triglycerides. These activate PPAR alpha, which increase the activity of lipoprotein lipase, which break down the triglyceride-rich lipoprotein like VLDL. Fourth question: which of the following lipid-lowering drugs may cause flushing as a side effect? Options are ezetimibe, niacin, atorvastatin, evolocumab. Answer will be niacin, because it causes vasodilation, which leads to flushing, especially on the face and the upper chest. It is due to the prostaglandin release, which can be reduced by taking the aspirin 30 minutes before the dose. Fifth question: a patient taking simvastatin should be advised to avoid which of the following? Options are high fat meals, grapefruit juice, dairy products, leafy vegetables. So the answer will be grapefruit juice, because it inhibits the CYP3A4 enzyme which metabolizes the simvastatin, which can increase the drug levels, leading to higher risk of myopathy and rhabdomyolysis. Sixth question: which of the following is a monoclonal antibody used in the hyperlipidemia patient? Options are rosuvastatin, fenofibrate, ezetimibe, and alirocumab. So the answer will be alirocumab, because it is a PCSK9 inhibitor, which is a class of monoclonal antibody. These drugs prevent the breakdown of the LDL receptors, leading to more receptors on the liver surface and better LDL clearance from the bloodstream. Seventh question: what is the mechanism of action of ezetimibe? Options are it inhibits the cholesterol synthesis, it inhibits the absorption of cholesterol in the intestine, it inhibits the VLDL secretion, and it increases the HDL production. So the answer will be it inhibits the absorption of cholesterol in the intestine, because ezetimibe blocks the transporter directly in the small intestine, which reduces the absorption of the dietary and the biliary cholesterol. It is often used in combination with the statins. Eighth question: which of the following is most likely to cause myopathy when combined with a statin? Options are ezetimibe, niacin, cholestyramine, omega-3 fatty acids. So the answer will be niacin, because niacin, especially in high doses, it can increase the risk of muscle toxicity when used with statins. So the patient should be monitored for signs like weakness, muscle pain, and elevated creatinine kinase. Ninth question: which lipid abnormality is most commonly associated with pancreatitis? So options are elevated LDL, low LDL, elevated triglycerides, and elevated total cholesterol. So the answer will be elevated triglycerides because triglycerides above 1000 mg per dl they can lead to acute pancreatitis. Reducing the triglyceride levels is very crucial to prevent from a life-threatening condition. 10th question. Which drug is a bile acid sequerin used in the treatment of the hyperlipidemia? So the options are ezetimibe, colesevelam, gemfibrozil and lovastatin. So the answer is colesevelam because it binds the bile acids in the intestine which prevents their reabsorption. This also forces the liver to use more cholesterol to make new bile acids which reduces the LDL levels in the blood. So, thanks for watching. If you found these questions helpful, don't forget to like, subscribe, and hit the bell icon for more high yield pharmacological and clinical topics. See you in the next video.